Good afternoon, everyone. Good afternoon, Minnesota. Welcome back again to the Pool Reporters. Thank you for the work you do. I know it was a spectacular weekend weather-wise outside. I hope everyone had the opportunity to do what they love doing, stay social distanced. I know I want to thank the folks over at the University of Minnesota. My wife and I moved our daughter Hope out of Frontier dorms over there, and I just want to say how professional the operation was. You signed up for a time to get there. The moving carts all had plastic liners in them. All of the folks had masks and gloves, and you were in and out. They took the baskets or the things you were using to move out afterwards, and they had folks there disinfecting them. So thank you to the University of Minnesota and the staff there for making that work so well. Not the way she imagined finishing, not the way many on there. My niece's home was a senior. She played soccer at Boston University, and just how this year ended, all those memories and all those things, I know it's pretty tough. I think we're all reminded of that T.S. Eliot's April is the cruelest month. I thought looking back, we went into April, and April 1st was 629 cases in Minnesota and 12 fatalities. We left it with 7,234 cases and 428 fatalities. So certainly true this year that it was a pretty rough April. I also want to take time to acknowledge yesterday was World Press Freedom Day. This is the basic belief, and there's organizations that track this, that the foundations of any democracy and freedom is predicated on a free press and journalists making sure they're able to have access, ask questions, and track down the truth. And so I want to say a thank you again to the journalists, both here as part of the press pool and those in Minnesota that continue to ask the questions, continue to bring up concerns, and continue to put out facts over fear to people. It's certainly become very clear what essential work is, and journalism is one of those. Today we're going to take some time to highlight, and you're going to hear from some folks that are ground level on this. This issue of interacting both with healthcare professionals, interacting with public safety folks, and interacting with our business community. It's something that I spend most of my day, I know the commissioners do, of trying to get out there and listen. Usually it's virtual that we're doing it, but to hear what's going on in these businesses. And we're going to hear from Liz Raymer, who heads up, I would argue, the most difficult job right now, quite honestly, heads up Hospitality Minnesota. The folks that, the trade group for our restaurants, for our resorts, for all of those types of outdoor activities and indoor activities that are part of what, again, I would say, not just a huge component, $10+ billion industry for Minnesota, but part of the heart and soul of all of our communities. And Liz is going to talk about a little bit about what's been, what that looks like and what the path out is. And then we'll hear from Abdi Kahin, who was the founder, CEO of Afro Deli, which many of you are familiar with. These are entrepreneurs. They have been hit the hardest, and I think the outreach, and you're going to hear from Commissioner Grove, is what are we doing on a daily basis to listen to folks as they are crafting some of these plans to figure out how do we live with COVID in a way that keeps people safe, but still look at this idea of how does the economy come back, because this is the question that's vexing everyone. And as I've said before, it is just the way it is, but it appears like there's 50 different strategies. I just got off an hour-and-a-half phone call with the other governors where they're giving their best practices. They're saying what they're doing, where some are opening up and how they're doing it. But the trade groups you're going to hear from and the actual folks on the ground are going to tell you what they would do. So I think it's critical that these conversations happen. We're using all kinds of surveys, tools, emails, and then, of course, listening to them. I think that's how this One Minnesota is actually going to work. So Steve will dive into that a little bit deeper. I also want to note that this week is Child Care Provider Appreciation Week. This was going to happen, and it does every year, regardless of COVID-19 and the situation we're in. But signing that proclamation this year really stuck home. This is going to be critical, and I would like to say, I think the early thought that went into this from the Children's Cabinet, from employers, from school districts that thought about what a reopening is going to look like and what stay-at-home orders look like with childcare is going to be absolutely critical. Our childcare has remained open during the pandemic, implementing significant changes to meet the health needs. Thousands of family childcare providers are stepping up to care for emergency workers. This is time to pause. A lot of these are formalities, but they're formalities that we take seriously to pause. So this week, think about what's gone into this and all the partners that helped with them. I think some of you remembered a few weeks back we had companies providing bleach, and we had Cub Foods providing wipes and making sure that all the things that a daycare provider needs is there. So this commitment to children runs through Friday, May 8th, and I urge every Minnesotan, if you get a chance, thank them. Some news on a new executive order. One of the things we're seeing is, of course, this would not be uncommon, is folks that are experiencing the financial hardships. Now, certainly I want to thank Commissioner Grove. I want to thank the federal government and the administration for moving quickly on unemployment benefits, the extras that went into that, some of the PPP program that helped small businesses. But there's still some situations where folks, because of the situation they're in, were getting their wages garnished during this time. This puts a hold on those. It does not for child care, and it was done in cooperation with, with making sure the payments for children and things were part of that spousal support, and those things remain part of it. But working with the financial institutions to make sure that this was done fairly. This is not to say that these debts were not legitimate debts, but what it's saying is now is not the time to collect from the most vulnerable, and this should hopefully bring some relief. But those child support payments still remain part of what needs to happen. So we take the step today to hope we get through this pandemic and we come out the other side looking a little different on it. So today you're going to get some detail on these collaborations. I thought it was important to use the bulk of the time to hear directly from industry representatives and entrepreneurs who are being hit the hardest, and how we are thinking about and the collaborations that we're doing on getting that reimagining Minnesota's economy. It was a great call this morning with a lot of business leaders, and President Kashkari was on, I heard, speaking, and the Fed. We have a lot of resources here, and we have a lot of smart thinkers, and I think this collaboration that Commissioner Grove is putting together helps us look both triaging short-term and the healthcare crisis. It looks at what does a modified new norm on restarting businesses look like, but I think just as important, what does over the horizon look like? What does 12 months, what does 3 years look like? And I think that will come in conjunction this week, and we'll probably have an announcement in the next day or so of moving back elective surgeries to be able to happen again. I talked about that April being the cruelest month with those numbers. It was also a month of preparation. Joe Kelly and the team in the Emergency Operations Center, we went into April in pretty tough shape on terms of beds, things like that. That was if you remember, the very first week of the stay-at-home order. We came out of April as well positioned. As I talk to people, we will have ICU capacity and ventilator capacity that is raw numbers greater than Illinois, with a population over 2.5 times bigger than us. So there is that side of it. But there's the other side that we're going to talk about, I think, in more detail tomorrow. I asked for and had our chief financial officer, which is the Commissioner of Minnesota Management and Budget, Myron Franz, asked for and put together a budget forecast. Those of you who are around this and you hear this all the time, we have a November forecast, and then we have the February numbers. Well, things changed dramatically from February till today, so we're going to have updated budget numbers to share tomorrow that will give us what the next year to the end of the fiscal year, or to the end of the biennium, looks like, and starts let us plan accordingly with the legislature and things that need to happen. So with that, I think we'll get some of the details of where we're at, and there's again, I would remind folks, as Jan shares these numbers, she will do it too. As you test more, you're going to find more cases. The real thing here is how sick are people getting? Are they getting the care they need? Are we getting them better? With that, Jan.
Thank you, Governor. Good afternoon, everyone. Here with today's situation update from a health perspective. Globally, as of early this morning, we had more than 3.5 million cases and 247,000 deaths around the world. In the United States, We are now over 1.1 million cases and approaching 68,000 deaths. And I think it was reported over the weekend that the death total from COVID has now surpassed that of the Vietnam War. Surely a sad milestone to note. Here in Minnesota, as the governor said, as of today, we are reporting 7,234 cases in Minnesota. We saw 1,000 new cases just over the weekend. So when the governor was talking about ending April, we ended April 1,000 cases less than we are as of early May now. So 1,000 cases over the weekend. Just over a quarter of all of the cases that we're reporting currently are coming from those 5 counties that are experiencing significant outbreaks surrounding food processing facilities. So that just really illustrates, I think, powerfully how quickly situations can change at the community level. And that is of deep concern, obviously, to all of us in the state. And the governor mentioned, too, our new total of 428 deaths in Minnesota. That was 33 increased deaths over the weekend, 24 reported on Saturday and 9 yesterday. Again, from yesterday's total, 7 of the 9 deaths occurred in residents of long-term care facilities. Among these 9 deaths were 7 in Hennepin County and 2 in Stearns. 2 people in their 90s, 3 in their 80s, 1 in their 70s, 1 in their 60s, and 2 people in their 50s. There are 396 patients currently in the hospital, 166 of them in intensive care. With the volume of testing going up, and we're very pleased at the progress, we had a little over 3,200 tests yesterday, lower than we did on Friday, but that's sort of the typical pattern during the weekend and Monday and Tuesday as test reports come back in. So we'll see those numbers heading back up over the next few days. But we definitely are considerably further ahead of where we were last week. And as we test more, we will find more, as the governor has said. So we're expecting to see those numbers on both fronts continue to rise, the testing volumes and the cases that are discovered as a result. As I mentioned, those 5 counties with current outbreaks are a source of a lot of work in testing, a lot of work in the healthcare system, a lot of work in the public health system as we seek to identify all of those cases, investigate them, interview them, find the contacts. And these are particularly challenging investigations as many of the workers involved don't have phones, don't provide phone numbers, aren't answering the calls. So it's been a very labor-intensive, shoe leather kind of an approach. Working very closely and very grateful for local public health assistance in those difficult investigations. I just want to reinforce that as we are adding more cases each day, we continue to try to look for ways, and you'll hear more about this today and in the coming days, continuing to look for ways to safely turn the dial incrementally to open more business activity and, as we'll talk about tomorrow, more healthcare access, which is so important. But to make this work, we absolutely need Minnesotans to keep on focusing on those personal actions we can all take around social distancing. The stay-at-home order remains in place for another 2 weeks, and we really need people to observe that by staying within their household groups and only going out for brief errands or allowable business activities. Our teams at MDH, DEED, and elsewhere are working hard to develop safe reopening plans, guidance for settings and businesses to be able to increase economic activity, but in a way that doesn't further fuel community spread of the virus. That just is so important that that the businesses are doing what they are doing to plan and prepare, to change business practices, to incorporate best practice guidelines about how to enforce social distancing, how to have enhanced screening, the critical importance of health screening for workers and customers likely. But for individual Minnesotans, we really need to keep that up too in our personal lives. And that means even with fishing open or coming home, coming up, staying close to home, enjoying those outdoor activities, but doing so with a minimum of travel is what is advised from a health perspective. We have to keep on keeping these good behaviors not only when we're going to work and engaging in economic activity, but when we're walking through our neighborhood or going to the hardware store or the grocery store. So thank you, Minnesotans, for the work you are doing to make it possible to continue to find ways to reopen our economy in a safe manner. With that, Commissioner Grove.
Well, thank you, Jan, and thank you, everyone. Good afternoon. As the governor said, over time, one of the hallmarks, really, of us getting this process right to safely reopen our economy is really thoughtful planning. And from the very beginning, we felt like we're not going to get that planning right just inside of government trying to figure this out. We've got to be in constant contact with businesses, organizations, labor leaders, others throughout the state that can help us understand both the big picture, but also the very specific picture on how to get this right as we begin to reopen businesses over time and turn that dial carefully, slowly, methodically, so that we're keeping Minnesotans safe, but also growing our economy and making sure that we take care of people's livelihoods too. And so we want to take a little bit of a moment today to walk through that engagement process, how we're learning from organizations and businesses across the state, just to give you a picture of what we're doing, and then most importantly, to hear from some business leaders themselves about that engagement process to give you their perspective on this, so you can see a little bit of our process in action as we go through these days and weeks ahead. So, as the governor said, we are working with Minnesotans across the state on this response, and a lot of these conversations are, of course, virtual. They're over Zoom and WebEx and what have you. So a lot of in-person conversation over video conference, and a lot of surveys and tools that are used as well to take polls and understand from the perspective of different business owners and labor leaders across the state how we can get this right. Letters, emails, phone calls, we get a lot of incoming. We read all the incoming. We filter it to the right department to manage and respond. A critical part of this is making sure that we're being responsive as state government to the questions and concerns and ideas that are coming in from Minnesotans across the state. So in terms of how we're thinking about safely reopening the economy, I just wanted to talk through a little bit of some of the objectives here. And I think, as we've said since we announced the plan for reopening a few weeks back, we ought to be very careful and move carefully along that dial in terms of size, predictability, and contact type to ensure that we are carefully reopening the economy and looking at those factors that, as the governor said, incorporates public health, social distancing, and societal well-being. All those factors play into these decisions. At every one of those turns on the dial, we are talking extensively to community leaders in concert, in conversation with them to make sure that we're mindful of that guidance. As you've seen in the first two clicks of the dial that the governor's made so far, each time we make a move on that dial to reopen part of society, it comes with a very careful plan in place. So the Department of Labor and Industry, DEED, the Department of Health, we have created these templates that are there to help workers and businesses stay safe. And every business and workers across the state have to determine the specifics of their plan that makes sense for their specific footprint. But there's some broad guidance there as well, really pulling from the CDC, pulling from MDH guidance to make sure that every business that reopens has that plan and can post it and share it with workers who come into their businesses and work every day, and increasingly now customers too, as customer-facing interactions will become part of these future developments. And then, of course, we're constantly monitoring progress. So we don't just click a dial and walk away, of course. We are constantly in conversation with organizations, with workers, with labor unions, with businesses to make sure that things are unfolding as planned. So very acutely and specifically, we're having targeted conversations with different business sectors. And you see some of them on the slide here. And it's important for us to have different conversations with different types of organizations because things are different in a church versus a business, versus a barbershop, versus a youth recreational facility, versus a small retail association. The broad guidance will always apply. We've got to stay safe. We've got to wear masks. We've got to stay clean. We've got to make sure social distancing is in place. But that plays out in different ways in, say, a gym than it does in a church or in a restaurant or in a bar. And so we're having these targeted consultations with trade associations, chambers of commerce, labor organizations, industry leaders, faith communities that really get quite specific. I mean, we're getting into the weeds of this stuff. How does it work in different settings to get social distancing right, to get health screening right, to make these moves carefully? Beyond just these conversations, we're also using data. And so we've had a survey out there. We've reached almost 8,000 organizations across the state with very specific polling questions on exactly how to get social distancing right, how it's playing out in workplaces that are open, what we can learn from the experiments that are taking place out there in critical sectors today. And you can see here on the slide just a kind of a picture of the types of organizations we're talking to: professional service organizations, manufacturing, retail, healthcare, arts and culture, government organizations, of course, education. We've been talking for months there, bars, restaurants, and hospitality organizations, community organizations, nonprofits, and a whole host of others. So as I said, we're talking to about 8,000 people via this survey that's quite detailed. And just to give you an even greater sense of how detailed it is, this is a bit of an eye chart. I don't expect you to be able to read it, but we are getting really specific on industry type, right? So healthcare, it's not just healthcare writ large. It's hospitals and clinics, it's dental offices, it's medical offices, it's chiropractor offices. There's some specificity here that's critical. So that survey's been a critical piece of feedback for us as well. And then in addition to these targeted economic conversations about business settings and organizational settings, we are talking to other groups who are giving us wisdom that builds into this guidance and these plans. So we talk very regularly with the tribal leaders of the 11 tribal nations who share geography with Minnesota. Advocacy groups and nonprofits. DEED does a call about 3 times a week with these organizations to help both share information but also get feedback. We've been doing weekly and biweekly calls with the chambers of commerce and trade associations, economic development authorities, consumer advocates for older adults and people with disabilities, disability service providers. That's a critical market that having conversations with matters. And you can see more here: labor unions, long-term care providers. All these conversations take on different complexions based on who we're talking to. But we want to just take some time to share who it is that we're engaging with, to give a picture of how expansive this needs to be for your government to serve you well. And so this gives you that picture of the groups that we're engaging. And lastly, on this point of feedback, I would just say this: we want to hear from every Minnesotan if we can. And so, to be one Minnesota, we got to hear from all of Minnesota. And so there is a survey up on mn.gov/deed/safe work, where any Minnesotan who would like to is submitting thoughts to us on how to get social distancing right in a lot of different contexts. We compile that every couple of days, and we're looking at those submissions, and it really is helping us navigate this effectively, and it's helping the governor understand how we would get this right when it is time to make further expansions and loosen some restrictions. So this is an important part of our process. We wanted to go into some more detail on it today. And as the governor mentioned a moment ago, even though in the short term we've been very focused on critically important sort of crisis-oriented metrics. We're looking at hospital care and PPE and healthcare worker quotas and of course tracking the epidemiology of the disease. We can't wait until it's over to start planning for the longer term. And so later this week, you're going to hear a bit more detail about a new council the governor is pulling together called the Governor's Advisory Council for a Safe and Inclusive Economy. And this is something we want to start now because we have to be thinking longer term right now about how Minnesota's economy is going to bounce back from this and how we can make an even stronger economy on the other side, because we are going to recover from this crisis. And we need to be learning from the best minds in the state, the best leaders from a variety of different sectors to ensure we're giving the governor the best advice he needs to make thoughtful decisions. So this council is going to be made up of industry leaders in business, labor, higher education, academia, the legislature, DEED and DLI, our Department of Labor, will play a leadership role here with the governor and supporting him. And we're going to be asking questions in the medium term. What is it going to take to rebuild our economy? How can we reskill our workforce for the jobs that lie ahead and retool some of our tools inside state government to make sure we're re-engaging workforce in the right way? How do we reimagine workforce development for the 21st century? Is it all brick and mortar? Are there digital tools? We need help to make sure we can navigate that right for Minnesota businesses. And then in the long term, of course, we're asking some bigger questions. How can we reimagine Minnesota's economy in a way that is more equitable and inclusive than ever before? We all knew the disparities that existed in the state going into the crisis, and the crisis has made many of them worse. As you've heard the governor and lieutenant governor say repeatedly, we've got to have the right strategies in place to make sure coming out of this, we bounce back even further for those who face the biggest challenges. So these are the kinds of questions that you'll see that council address. We're eager to address leaders across the state in that effort as we think both about this short-term kind of reopening and safety preparedness for the crisis at hand, and then longer term about our state's economy and all that lies ahead. So wanted to give that preview, but most of all, wanted to give you a chance to hear from some of Minnesota's leaders in this space. And so we're very thrilled today to be joined by Abdi Kaheen and Liz Raymer. Abdi is the CEO of Afro Deli, an amazing business. Abdi himself, an immigrant who has built an extraordinary business here in the Twin Cities and has done much for the community in addition to innovating ways that his business can survive during this time, and has given us lots of great advice. And then Liz, as the governor said a moment ago, runs Hospitality Minnesota, an incredibly important trade association who has given the governor, myself, many of the leaders in state government lots of advice on how to get this right moving forward. So we'll have Kaheen come first and then Liz after that. Thank you both for coming today.
Thank you, Mr. Governor. Thank you, Groove. My name is Abdurrahman Kaheen. I'm the owner of Afro Deli and Grill. It's 5 restaurants in the Twin Cities and a grab-and-go line where we provide grab-and-go to gas stations and convenience store at the airport. And as a small business owner and community leader, I have seen a lot of the last years. But this pandemic has presented new challenge for my business. Through it all, we continue to focus on the health of our employees and customers. We appreciate Governor Walz and Lieutenant Governor Flanagan for their steady and strategic leadership. They know the most important priority is the health and safety of Minnesotans, and we believe that too. I have been with Governor Walz and Commissioner Grove strategic leadership to chart the course of how we reopen Minnesota business or Minnesota economy. These are tough decisions, but they are listening to my feedback and the suggestion that I'm giving on the table, and also they're listening also the other businesses across the state. It's important as we develop a plan for reopening in a safe way that protects employees and our customers. And I appreciate the leadership that the governor and his team are doing for Minnesota. As a small business with 5 restaurants, only 2 restaurants are right now operating, and we are ready to implement with the new guidance of the governor and his team. It's going to be very tough, but the safety of our customer and of our employees is very important. We will adjust, hopefully, for the next few months, how we're going to operate in a safe way, so we protect our lives and our customer life. As you know, this is tough time, but 2020, if we go through safe and healthy, it's a profit for us. So we will be ready to go through this, and as a Minnesotan, we're going to stay strong, and we are this together. Thank you very much.
Liz, thank you.
Hello, I'm Liz Raymer. I'm the CEO of Hospitality Minnesota, and our organization represents more than 2,000 restaurants, lodging facilities, resorts, campgrounds, outfitters, and many more. Many of these are independent, family-run businesses that employ right now 300,000 people throughout our state. It's a very big industry. And I want to thank today Governor Walz, Commissioners Grove, Commissioner Malcolm for their great leadership. We really do understand that this is very complex, and there needs to be thoughtful care and consideration given to all parts as we address this today. We want to thank you, too, for acknowledging the monumental hit that the hospitality industry has taken on in the face of this crisis, and really the work that so many continue to do to feed and to lodge people, to keep people upbeat and happy, even during very tough times throughout our many communities in Minnesota. We're confident that Governor Walz and his leadership team understand the dire consequences our industry faces right now. We know from our recent survey that more than half of these businesses face certain permanent closure in the next 2 months on the current course. We share the common goal to protect and support both the public health and our economic recovery. The hospitality industry is vitally important to Minnesota, both its economy and its culture. These businesses are who we are as Minnesotans, and they're the fabric of our communities throughout our state. We're confident, too, that our hospitality businesses are ready to open now. Our businesses and the public, they're ready to approach this new normal. They understand that there's going to be need for promoting effective social distancing, enhanced sanitation processes, and ways to engage with one another in a meaningful and safe way. We know we can achieve the same or better and really understand the level of predictability and safely as other businesses with the right protocols and the public commitment. It really is a two-way street. So to that end, we're working collaboratively with the governor and his team to finalize guidelines for this industry, drawing on the expertise of our membership, the guidance from federal and state agencies, and the expertise of our industry colleagues around the country. We have the great advantage to be able to take information in from many parties throughout the country and from different organizations that help us understand these protocols and the needs going forward to protect our communities and our employees. We also know that unless these businesses receive support that really better reflects the needs that the current federal programs offer, many will simply not make it. Reopening won't be sufficient. These businesses really need an extra hand up. We also know we need to work hard to build consumer confidence to a successful outcome, and that's going to be key in this two-way street. 300,000 jobs in Minnesota depend on us getting it right, and they hang in the balance. The community experience that we know and love, meeting friends at a restaurant, welcoming guests from around the world at our many great hotels and motels, spending a week at the lake resort, returning to a community or a campground, and of course, access to our wonderful Boundary Waters community area. These are all also hanging in the balance. So we need to get this right to bring these businesses back to full health, and we're confident that we can do that beginning immediately. So in closing, we really look forward to working with Governor Walz and his team to finalize best practices, confirm a reopen date with adequate notices so that businesses can prepare and really secure, again, economic relief that these businesses so desperately need. Thank you.
Thanks, Liz. Well, before we take questions, I want to say thank you to Liz. And I think it's really important for Minnesotans to understand this is a voice, as you heard, is trade representative of 300,000 workers, tens of thousands of businesses, key to both small and city life and our cultural life. And I think it's really important for Minnesotans to see that voice is being heard in this space. I think for those of you out there asking, are you taking into consideration how do we redo this again with the people who are doing it while you're listening to the public health officials? And the answer is yes. And I just want to say having that strong voice with Liz here, with Kaheen and the representatives, it helps make sure, and I want to be clear, not a single one of these people have ever asked us to put anybody at risk. They've asked us to try and understand what does the data show, what does the research show, where can we get to, and what's our plan to get these going. And I think it would be remiss if I did not say this. Kaheen will not say it himself, so I will say it for him, plus your countless other folks in this. During a time of an existential threat to their businesses, these are the businesses that rose up, and in Kaheen's case, providing free meals to children since this started, at his cost in the middle of all this. And I think Liz would attest that has been replicated hundreds, if not thousands of times. And I think that idea that this truly is the hospitality, this truly is about making community, and I think that needs to be noted. Today's a day where customer-facing retailers are back trying curbside service. Those are plans they worked with Commissioner Grove. I would make my plug here, shop local. If you need something now, these are the folks to go get from. We're going to try and have to figure this out. I saw things like dry cleaners and things came up online and are doing curbside and delivery. Those are the types of things we can take advantage of. And obviously that's that next step of stepping back in. I would like to take note before we take some questions. One of the things I hear a lot about is the idea that rural areas that aren't hit as hard to roll those back in. We talked about, does that create a patchwork of things? There's a logic behind it that is that at first blush is pretty undeniable, that why wouldn't you let some of these places that aren't as populated and have hospital capacities, use that as a test ground to start rolling back in. There are some states looking at that, and I will tell you we are certainly willing to look at everything, but I would remind folks about how quickly this can change and then how difficult this can be. For example, Nobles County now accounts for our second highest total. I think they're about at 1,100 cases, Jan, roughly as of today. Nobles County has 21,000 people. So 1 in every 20 people, statistically, are infected there. Ramsey County, on the other hand, has 550,000 people and has about 500 cases. Now, Jan would tell me one of those reasons might be is when JBS started to go, we tested heavy, and our testing numbers might be disproportionate. But it doesn't change the fact that this virus, either on a macro scale where density matters, you saw in New York City, or micro density, like in a congregate care facility or a processing plant, we have to be careful that same thing doesn't replicate itself in a restaurant, doesn't replicate itself in a school classroom, whatever that might be. So these are the considerations we're taking in. But I just do want to say, if I could make the plea to everyone, and this keeps coming up, a stay-at-home order is trying to align in using the state's ability and the ability of the governor's office to try and align our resources and make a difference. But I think most of us know, regardless if it's speeding laws or moving up to other things, social compliance is the idea that the actions that we do don't only impact ourselves, they impact others. And as these restaurants are doing the best they can to try, and once we get to the point, and we will get to the point where we start going back into them, at least for the foreseeable future, they're going to need our help. And I know anecdotally is not the way to go. We look at data all the time, but I can tell you this. There's a psychological aspect that will come with the state's ability to test, trace, and isolate, and there will be a psychological ability to folks to wear masks. And if this whole mask thing is being debated, and I do want to thank Vice President Pence, who mentioned that he made a mistake at Mayo Clinic and should have wore that mask. And I am grateful for that, because I think all of us, as that became an issue, this is not a political issue, and wearing the mask does not stake you out in any one place. It is simply a respectful thing of the epidemiology shows that the chance of you infecting someone else can be cut down. I also think it sends a message, as we talked about, you're not touching your face and you're staying social distance when you wear a mask. So I'm going to make my appeal again to everyone. It is not our intent to force these things. And in our executive order, we did not mandate the wearing of masks. But what I can tell you is to do these things will speed the opening of these small businesses, will speed the chance that we can reduce the numbers and start moving in a more, I think, a more aggressive way to start catching up with those businesses. With that, questions? Dave.
Governor, I heard the hospitality industry is ready immediately to reopen. I heard the Alfred Deli saying he's ready. We hear this from restaurant owners and all the time as well. You said you're looking to do that soon, and you want to give dates. When?
Yeah, I think it's always hard on the dates for us to see. One of the things is that we knew before we could have that happen is we had to catch up with testing and tracing. We needed to make sure that we had those things in place. I think the sense of urgency that I have, and I think the statistic is this, I think in Minnesota, you correct me if I'm wrong, Commissioner Grove, that there is access to working now for 91%. The bulk of those fall into this industry for the most part that we still have out. So I think the sense of urgency we have, and I think it's no mistake that we brought these two folks here today. Dave, I don't have an exact date, but I think, Liz's point is that the sooner you can get to that, the sooner you can get certainty, the better. I heard a great quote today somebody sent me, and I'm not sure who said this. I think it was one of our business leaders here, that at a time of great uncertainty, it's maybe less important to be certain than it is to be clear. And I hope what we're doing with Liz and what we're doing with Gaheen is to try and be as clear as possible what our expectations are, how we're trying to work through that complexity, and again, not to let it grind in a bureaucracy, but understanding that it needs to happen quickly. So, Dave, my hope was over these 2 weeks you would start to see some changes in things. And I am very interested in looking at other states and other models to see what works on this. Again, I'm going to go to my health experts who are going to make a wise decision and say, you know what, this makes sense. I asked Liz this question too, is some of the suggestions I've heard is 25% capacity. And I just asked, does that make economic sense? You've got a higher overhead if you open up a whole business. You bring people in, you're opened up at 25% capacity. If that's the theory, does that make money? Those are the things that I think we're trying to kick back and forth.
There were
business leaders and church officials at the Capitol today asking if there could be a timeline, if they could get a sense of when they might be able to get back to work and what they could be doing ahead of time. What guidance do you have for them?
Yeah, I think we've set the guidance on what it's going to take. We've set during this time, both PPE capacity, hospital capacity, testing capacity, if those are ramping up. I would note there is not a single state, I don't believe, that has actual dates on each individual industry. They might be, some of them have chosen to say, yep, we're flipping the switch and we're all open up again. I still don't believe that's the proper way to go. I think we're trying to give as much guidance as we can, as quickly as we can. I think we showed on the dial our thinking is that it was going to be easier in these predictable settings to open up and then move to some of the non-predictable. My pledge to them is to get them as quickly as we possibly can. But the virus does not care, and I remind people of this, around this. Cases are going up in the United States. Don't just watch New York City for where things are at. Cases are still going up. The president himself changed his death estimates to 100,000. I am hearing today, I think, Jan, if you saw this, that they thought there would be a doubling during the month of May. So we will go up to potentially 120,000 over the next time. So we have to be very careful about this. If I could say yes Monday, that would be it. But I can tell you this, our desire to get, for example, Worthington back up again is going to be far more dependent on what we're able to put in place to socially mitigate, what are the things that we're able to do to test, what are the tracing that's happening in the contact tracing, and what is the company and those employees' comfort level about going back. So I hear them on that, but again, I think most of it on the call I heard this morning, and I think most of those leaders understand this. The real challenge for business lies over the horizon, and it's always been about building confidence. They know this. This is always about building confidence, getting back in. We've got to provide them that confidence, and I know one of the things that we can do is it's not necessarily a stamp of approval, but it's a belief when people are listening that we are not going to open up something and risk their lives when we balance those out. So when they do, and when that does come, there's a much better chance people will go back to it, because you're seeing some fascinating statistics about businesses that opened up in Georgia and nobody showed up. Well, that's what consumers are going to do. They go where they feel safe. And again, these folks are going to do that. They're going out of their way. And in many cases, what we've seen, Steve, you could probably talk to this, the plans they put in place go above and beyond because they have to. Oh, can I go, Esme, and then back to you, Dave?
Yeah, Governor, the House Minority Leader has said that there should not be a bonding bill during this emergency time, and he says that he is going to be able to block it effectively, so there will be no bonding bill. What's your comment about that, and do you think there will be a bonding bill this year?
Well, certainly the minority leader can block it. That's what happened last year, and that's why we didn't get a bonding bill last year. What I'm hearing is there's strong bipartisan support to do this. I think most people recognize that as a stimulus program, bonding at the historically low rates, and I think we'll know a little bit more tomorrow, and we've been tracking this a couple times a day. I'm getting updates on where revenues and expenditures are at. It makes good sense for Minnesota to do this. These are projects that are going to be needed, not just in job creation, they're going to be needed for the vitality of communities afterwards. These are bridge projects, these are water treatment plant projects, these are in quality of life enhancements. And so I have heard nothing other than positives. I think the only debate is the size of the bonding proposal. So my hope would be is that as folks step back and look, and I'm certainly trying to do the best I can to collaborate. I think one of the things is the emergency orders give me some flexibility to use things like deploying the National Guard or changing truck weights, for example, instead of going through the entire legislative process. But we're trying to communicate those things to them. And I have to think that we can do several things at once. I don't think one is predicated on the other. We're still functioning in a way. I do think it was probably wise to take off some of the more controversial things that we were probably going to debate this year and just get to the heart of it. So I'm still very hopeful.
But he is suggesting that you basically are, through these emergency powers, acting unilaterally, and it's time to get the legislature involved.
Well, I disagree with that, but I would like to see some consistency on the federal level then, that I haven't heard a single thing about a federal authority on this. And I think people, when they hear that, if there is a consistency to it, I certainly think that there's a better way to do this. But I wish we didn't have COVID-19. But I can tell you, if we had to wait to make some of the decisions we've made, I don't think we could have ever got there. I think it'd have been very, very difficult to build a coalition around testing. my goodness, it took us 24 months to get insulin done, and some of this just requires this. And again, I recognize this too. There will be an accounting of everything we've done, both a literal financial accounting and then an accounting of how we handled this. I would argue at this point in time, that authority is moving us in a direction that is flattening the curve, that is building up PPE, that is moving businesses back to operate. But I certainly respect the legislative branch to do it. I oftentimes know, and I would reflect this, if you want to know what one of the most frustrating positions to be in is to be in the minority in a legislative body. I had that experience in the United States Congress, so I can understand the frustration.
Back to the earlier point about businesses, you spoke about how some may open up and they may not have the customers, and is this viable? But a lot of these are entrepreneurs in the American entrepreneurial spirit, and they're saying, look, we've got a plan that conforms with everything we've seen from the CDC and the state. Let us give it a go. If we're
That's
talking
what we're
about a
doing.
family business, but they're saying, let us open up now with this plan. Do you not trust them to
I do
this?
trust them. I think it needs to be thoughtful on this. Again, the better angels, we've seen don't worry, there's nothing coming out of this smokestack type of thing. Yes, I trust the vast majority, but every time we have one that doesn't happen and you get a hot spot, and the situation we saw is look how quickly one business turned into 1,100. And this is a company that knows they have to get their workers back. They care about it. They're trying to be with us. So it's not that. I think it's working through a process, and I get it, the sense of urgency. It's now been 38 days of this. That's what we're trying to get to. That is exactly, and I do trust that they're coming up with good ideas. The one thing is when I hear people say, I said it last week, if there's the desire that we need to have a sense of urgency and get these businesses back opening and balance it with public safety, they're exactly right. Those who say we need to open this up because it's overblown, it's just the flu, are dead wrong. And that's one thing that we can't go on. But I agree with them. And I ask people to help us create this capacity to be able to withstand the surge. And I think that's what you're going to see probably tomorrow, that the businesses opening back up directly impacted by that PPE, elective surgery will start to come back on. So I hear them, and I think they're not wrong. And I just think it has to be somewhat methodical. I think this plan's in place, and I think that they have every right to feel the sense of urgency, and it could move faster. I'm trying to move as quickly as we can based on the facts.
Governor, a question from Steve Karnowski with the AP. He's wondering if you would consider ordering National Guard members to work production lines at meat packing plants if they are unable to adequately staff?
Well, it has not come up in our conversations. I think I would be very hesitant for that. One thing is that this is very skilled work. It can also be not just in Corona, it can also be very dangerous work. I have a lot of experience with this, having represented the 1st District, and as I said, this was the industry of my father's parents, and have been around this. So I would have to think I would be very hesitant in that. And just to be clear, the president ordered that as an essential industry, but the one thing is we're being thoughtful, and I want to thank the folks at JBS. I want to thank UFCW, the folks down there of striking that proper balance, and they're kind of the microcosm of what this whole opening business looks like. Is we've been told to open this up for national security and the need. We know we need to get it back opened up. We're super nervous as workers that needs to be safe, and it's in everybody's interest to work together. And I think that's what businesses are saying. Why would we open up and put customers and workers at risk? We would never do that. And so I would be hesitant on using that I think we have to get this up with those workers who are trained, with those workers who are there, and with workers who trust, and the employees and employers trust that they're working together.
This question is from Theo Keith at Fox 9. It has to do with the timeline of opening. He asks, how much lead time are you willing to give people?
Yeah.
Some, like restaurants, say they need a couple of weeks to restock to be ready to go. That would be today. They'd be able to reopen on May 18th.
Yeah, I'm going to turn this over to Steve, and Liz may speak on this because she was said the exact same thing to me today. Is said you've got to give them as much lead time as possible. So maybe the two of you, if you want to weigh in on that.
Sure, thanks, Governor. And Liz really is the expert here, so I'll turn it to her. quickly, but I would just say that's exactly the kind of conversation that we're having with businesses. We've heard from restaurants usually is a week versus 2 weeks, but it probably depends on the restaurant and the supply chain that they're accessing for their food stuff. So, with curbside delivery and pickup, we knew that 3 or 4 days wasn't a ton of time, but it's more of a logistical thing. So we felt comfortable going on Monday after announcing Thursday. Same thing with manufacturing. But I would say for all these businesses, if they need longer, they can take longer. We're obviously not ordering businesses back or not. They can do this at the pace that's comfortable for them, and I think that that's really important. Liz, you'll probably have some further thoughts on this.
Yes, it does take time to bring your staff back. That's a key component in all this, and to make sure they're all trained with the new protocols and expectations in place, as well as, really the supply chain. It's been disrupted. It's been closed down a lot over these last several weeks, and that will take time to restart all of that, to be able to order the products and the beverages and all the things that they need to do to restock, because basically the coolers have been empty now for a number of weeks. And so all of that's going to take time. And the other piece of this is also expensive. A lot of these businesses, would be looking at incurring additional expense, and with limited or no revenue coming in, that's something that they really have to take into account. And as I shared with the governor and the commissioner, we need to have an actual deadline at that point, because people can't afford to have a change, because again, there's a considerable amount of expense that's going to have to go into this, and people are going to need the confidence that this is going to happen and it's going to go forward. And so again, it's that partnership and the collaboration working towards this, so that we get this right and that people and the public feels comfortable about coming back.
Thanks, Liz. Liz brought up a good point too. As they said, the worst thing that could be happen is to give them a potential date and push it back when they're doing this. And I think all of you have had a little over a year to see how we try and be very deliberate, try and be very collaborative. You can probably read into this that it wasn't by chance that these were the folks that were here today and that we wanted to hear from, because we're spending an inordinate amount of time trying to figure out, because we think this is one of the more difficult ones, but we're in total agreement that it is one of the most critical ones because of the volume of it and the number of workers. So that probably speaks volumes why these folks are here today.
Question probably for Commissioner Malcolm. Sure. We've had sort of this ongoing experiment, if you will, for 5 weeks with children in daycare settings, and as you mentioned, we appreciate them. Children of emergency workers have been in daycare settings. What do we know about the spread among the children? Obviously, they are children of people who have a higher level of exposure, but have we seen any clusters? Have we seen the workers in the daycare centers getting infected? What do we know?
Well, thank you. And I just asked that question myself a couple of days ago of our staff, and they tell me there's not a lot of new information yet, that we're still seeing a very low incidence of illness among kids, but it's still not as clear as we would like it to be what their role might be in transmission. There have been some, and again, we're reliant on international data as much as our own U.S. and Minnesota data. Particularly because we did close or go to distance learning early in the epidemic here. And in those situations, I think one of the things that's been challenging about this virus is how much has changed in what we know. The role of asymptomatic transmission was not something that was clear even a month ago, as clear as it is today. So I'm pushing for that same answer. Certainly no Minnesota-specific data to share with you at this point, but the epidemiologists are still saying it's a big question mark. What's the role of children in transmission?
And that seems that would be a crucial piece of information when you look forward to summer camps and whether they can open. Right?
And I would extrapolate it to schools. That's what we've been asking. I think you're exactly, if I could, you're exactly right. If this is not a vector where we're getting spread and it's in that, it would seem like that data. And just one of the things is, Jan is right, just the bandwidth to be able to look at all these things. I think that's where we're turning to the universities. We're asking them to look at that. I do think that is a critical thing for us to know, because they are up and operating and they're still able to do it. And I think that does shift how we think about this, because if that's possible to do that, is it possible to do it on the scale for those? And I do think I need to respond to those folks on summer camps. And again, just like this industry's doing, basketball camps. They talk about be one adult in there. There would be 10 or less in the room. There would be no spectators or whatever. They're thinking those through. And I think for this sustainability piece, so I keep challenging. It's easy to say no to that stuff because there is a risk. The question is it a small enough risk that the gains you get from it are worth doing it. And I think that's exactly the point that we're at. So that's a really good question.
Commissioner Malcolm, 2 questions for you, please. Can we get additional details about the person in their 40-somethings who passed away over the weekend? And also wondering, now that Stearns County has over 700 cases, is that somehow different than other meat processing facilities that seem to have lower cases in those counties?
Well, thanks for the question. I don't have any additional detail I can share today on the young person who unfortunately passed away over the weekend. All I've heard was that there didn't appear to be a history of underlying health conditions. Oftentimes, circumstances change the more you learn about a case, but that certainly, if that is the case, very, very sad, of course, and just another painful lesson about how this disease affects people differently, and that none of us who don't think we have the known list of pre-existing conditions can necessarily think we are immune from harmful effects. And in terms of Stearns County, I mean, I was just on a call over the weekend with folks there trying to make sure that local public health is getting more resources and more trained and supported by us to do more of the on-the-ground case investigations. As the governor said, the fact that we've got multiple things going on at once is really stretching our capacity to do the disease investigation the way we traditionally have done it. So we're literally going to have to invent some new ways of deploying that expertise and extending that workforce. So we're working on that right now in Stearns. It does appear that there is more community spread there. It's kind of a chicken and egg. In the case of Worthington, based just on the proportion of cases and the numbers, it appeared that even if it initiated outside the plant became such a kind of a magnifying force. It amplified the spread of the disease. It appears to be to a lesser degree so far in Stearns, but it's early days. So it does appear to us that there's more widespread community transmission there earlier on in the event.
This question is from my colleague Katie Steiner from WCCO TV, who is more than 9 months pregnant. And she is telling me that pregnant women such as herself are being told that they can only have one person in the delivery room, for example, a partner, not a doula, not another relative. She is wondering if that perhaps could be eased, or what kind of guidance you're giving hospitals on that, and do hospitals have the authority?
Jan, is that by hospital system? That's their call, or what are you putting out as far as statewide?
Yeah, I do think that it's important to leave a lot to the clinical discretion of those provider systems to do what they think is safest for their patients and their staff. And certainly we are encouraging providers to look at the guidance, make their own, but there will be a fair amount of individual professional discretion in what they are comfortable with.
A question from Jeremy Olson of the Star Tribune. He notes that as you look toward reopening elective surgeries, and you'll give a lot of latitude, I think, to the healthcare networks, we do have a high proportion of healthcare workers who have tested positive. Now, we've been testing them, we know that, but we have raw numbers up over 1,000, I think. Is there any concern about reopening elective procedures or non-life-saving procedures when you know that you have a population where the virus has been circulating?
Yeah, I think so. And again, this is where the expanded testing gives me more confidence that we have the ability to do that. Obviously, Commissioner Malcolm was very clear about this. Our goal was to test symptomatic people first, and then I think frontline. It does, but I think, if there's anybody who knows how to stay home, social distance, do the things necessary, it's these healthcare providers. But I think it kind of goes back to Esme's question. In the midst of all this, we really have to defer, and I am really hesitant to get in anything with the providers making these decisions of how they're figuring this piece to start bringing back the hospitals on. So it is a concern, but I think we have the ability to test.
Governor, can you give us any details on guidance coming tomorrow or later this week in terms of elective surgeries, how far that will go? And will that include dental procedures as well?
Yes, we'll. Yes, there will be, that will be part of it. I think we want to, tomorrow we'll give it in greater detail. One of the reasons was this was fairly complex, and I want to thank the folks. I think I heard this morning on our call that over the weekend they dug through about 1,100 comments made by the healthcare. We had that open for public comment, specifically looking at healthcare, dental, those types of things. The answer is yes, and I think we're scheduled. I don't want to speak out of turn here, but I believe tomorrow that there is going to be an announcement made on this, and I am leading to it. There is going to be an expansion of elective surgeries, and it's how that will roll out.
Governor, as you continue to open the state back up, this is from Ken Erdahl, CARE 11. What rights do employees have if they are concerned about returning to work either for health reasons or childcare needs? Will someone who is older and has asthma or a history of asthma or heart disease or type 2 diabetes be able to stay home without fear of losing their job? Will single parents with no option for childcare be able to stay home or use schools like healthcare workers?
Well, this is a great question, and to Minnesotans out there listening on this is really the one. I think there's a lot of folks, and they've heard in certain states that if you choose not to go back, then you can no longer collect unemployment insurance. Minnesotans always want to make sure that people feel comfortable going back. I think one of the benefits we have here is our business community working very closely with their employees, making sure, I want Steve to talk about this, that there are exceptions so that if you're unsafe, if you're caring for someone, that you can stay out of that. Our anticipation is the vast majority of people who don't have underlying health conditions, if their employee's safe, we've shown that it's ready to go, that will roll back in. But Steve, you want to talk about the specifics on those examples?
Sure. Yeah, I think the governor covered it well, and it is such an important question. We know it's on a lot of people's minds. I just want to remind Minnesotans about Executive Order 2005, one of the very first executive orders the governor put out about unemployment insurance. It went into great detail on the new cases that would allow someone to be eligible for unemployment insurance given there's a pandemic. Again, this is uncharted territory. Unemployment insurance law does not anticipate a pandemic. And so one of the very early actions he took was to make sure that anybody who has to stay home to take care of a kid because of the pandemic can continue to do so and collect UI. Anybody that has an underlying condition or is in an at-risk population can do so. If you've been exposed or have a relative who has and you're taking care of them or need to be in quarantine, all those things now qualify you for unemployment insurance. So that remains the guidance, it remains the law and how it will be applied, even as we open things back up. There's going to be cases we know will exist where workers and businesses disagree about a worker's eligibility to come back in. There is a process for adjudicating those claims that has been long tested and used in unemployment insurance in our department. We have adjudicators who are ready to navigate those claims quickly and make sure we get it right. But we hope, as the governor said, in a vast majority of these cases, businesses and workers will come to the right and generous place to make sure that those who are at risk don't have to come back and are taking care of themselves and not spreading the disease further by coming back into work.
Well, thank you all. And if you didn't need an example of why World Free Press Day matters, great questions. Thank you to the folks who are here. Thank you for that pool reporting. Thank you for continuing to challenge. To Liz and Rahim, thank you. I think challenging and asking those questions, finding a way to come together to get this working. And to Minnesotans who are out there, as I said, we entered April a lot different than we left it, but we're also a lot better prepared. We've learned a lot. We learn more every day. And working together, we will go through this. There's going to be a change of normal. I want to make that pitch again. I can't tell you how powerful it is if you're going to be out and you have to be out. Wear that mask, do the social distancing, think about why you're out there. I certainly am not going to discourage you to get out, do the things that keep you active. If you're going to parks or on lakes, stay close to home, continue that social distancing. All those things protect those healthcare workers from having an overflow at the hospitals. All those things make it easier and better to open back up these businesses. And all of that puts us into a new norm as we move to, and there has been really good news on the therapeutic side. I always think you have to vet, they have to be verified, they have to be peer reviewed. But in the time of COVID-19, I think every once in a while it's good to have a good story. My goodness, I woke up yesterday to the murder hornets. We don't need any more of that. What we need is there was a story out of, and a good study out of South Korea showing that folks weren't getting reinfected. If they were not coming down with it, which appears some of the first and broader study of immunity. I mean, those are things that we should be watching for. And if that turns out to be true, and we're able then to use a good serology test, and I think the FDA has started to crack down, get the bad ones out of the market, use the good ones, that's a game changer. That means if we have good, solid, and with good confidence level serology testing, and we know that you can't get reinfected, that is a game changer. So I would ask Minnesotans, now is the time to really buckle it down, get this right. We're thinking of these ways to do this. Shop local at your local retailers. Let's get this done. We'll continue to do our job here of finding new ways to get things done. But I'm going to close today. I have my story of how Minnesotans act, and there's so many of them. But last night, right about sunset, I heard a trumpet and a saxophone outside my house, and there was a band teacher and a retired band teacher who had pulled up, and they played the Minnesota Rouser in front of our house, which made my daughter cry almost because we just moved her home from the University of Minnesota. And then they played A Beautiful World, and it truly is. Neighbors came out, some folks stopped. This is tough. This is painful. This is causing economic damage beyond anything any of us who are living now, unless we lived through the Great Depression, probably have seen. But I think the pieces are there for Minnesota to be resilient. We'll know more tomorrow on state finance, state budget, and we're still working together. So Liz and Raheen, thank you. Thanks to the industry for what you do. We'll get back on the feet. We will go back to these businesses. We will break bread together, and we'll share those times, and we'll do it in a safe manner. So thank you all. Thanks, Commissioner.